Hi, my name is Jenna Monger. I'm a student nurse practitioner. I'm here to complete my head-to-toe assessment. This is Jeff, my volunteer patient. Before he came in, I had him empty his bladder, change it into comfortable clothes. We took a full set of vital signs, including height and weight. We checked his far vision with the Snellen chart and his near vision with the Rosenbaum chart. I assessed his gait as he walked in, which is nice and steady. He appears well groomed and well nourished. I've washed my hands, and so we'll start the exam. So to start off, I'm going to inspect his head. It's nice and round. It's normocephalic. I notice that his facial features are nice and symmetric. His eyes and his ears are symmetrical, and then also his nose is nice and midline. The skin on his face looks nice, dry, and no rashes or lesions noted. So I'm going to palpate his scalp, noting that it moves freely. I don't feel any masses. And there's no pain, correct?
Correct.
I see that his hair is well distributed. It's nice and thick and coarse, and there's no signs of hair loss. So the next I'm going to do is palpate the facial bones. So make sure they're nice, firm, and intact, which they are. I'm also assessing the sinuses, the facial, and the maxillary, which there is no pain, correct?
Correct.
Good, and there's no swelling. So next I'm going to test his sensation to light touch. So I'm going to have you close your eyes and tell me where you feel this.
Forehead, cheek, chin. Forehead, cheek, chin.
Good, so that is all intact bilaterally, both checking forehead, cheeks, and chin. So then next I'm going to assess his temporomandibular joint. And open and close, good. And I don't feel any popping or clicking, and there's no pain. So I'm also going to assess trigeminal cranial nerve and also his facial cranial nerve. So I'm going to have you again open and close and clench your teeth. Good, there's a smile. I'm going to have you puff out your cheeks. Good. Okay, and then I'm going to have you raise your eyebrows. Good. And close your eyes really tight. Okay, good. So everything looks equal bilaterally, and those nerves are intact. So then next I'm going to move on to the eyes. Inspecting the eyes, I can see that they're symmetrical. The sclera are clear and white. No jaundice is noted. And his conjunctiva are both pink and moist bilaterally. No signs of redness or drainage. I don't see any swelling. Next, I'm going to see the eyebrows are symmetrical and the eyelashes grow out and away from the eyes. I'm going to palpate next on the eyelids, making sure there's no tenderness or swelling. Sure there's not. And also the lacrimal apparatus, make sure it's nice and soft and there's no tenderness, correct?
Correct.
So everything looks fine there, and there's no drooping or anything or ptosis of the eyelids. So next I'm going to look at the pupils, and they are equal in size and 4 millimeters in diameter baseline. I'm going to check the reaction to light to both, look at me, both direct and consensual light, and the other side, direct and consensual. So the pupils are equal and reactive to the light accommodation to both direct and consensual light. So then next I'm going to look for any extra ocular movements. So I'm going to have you cover one eye, good, and uncover, and cover the other, and uncover. Good, so I don't see any abnormal eye movements when he uncovers his eyes, and there's no nystagmus, so that's normal. So next I'm going to test your peripheral vision, so please cover an eye. Good, and tell me when you see my fingers.
Yeah. Same. Same.
Good, and opposite side.
Same. Same. Same.
Good. So his peripheral vision's intact bilaterally. So next I'm going to have you follow my pin light with your eyes. So I'm going to assess the ocular motor, the trochlear, and also the abducens cranial nerves by performing this assessment. So his eyes move equally and bilaterally to both sides, and no abnormal movements. Then I'm also going to look at the red reflex, make sure everything is normal there. So just look a spot on the wall. Good. Good, so it's equal bilaterally. Okay, so moving on to the ears. Everything looks normal with his eyes. Moving on to the ears, I'm going to inspect the skin on both sides, and it looks good, even in color. No lashes, cracks, dry, scaly skin. No pain on the auricles when I palpate, correct?
Correct.
Okay, good. So then next we're going to test your hearing by performing the whisper test. So I'm going to get behind you, and you include one of your ears, and repeat after me.
Apple.
Good. And our switch.
Orange.
Good, so his hearing is intact. Next we're going to do the Weber and Rhine test, assessing his ability to hear air and bone conduction and vibration. So first we'll do the Weber test and make sure it's equal. Is it equal?
Yes.
Good. So then next we'll do the Rhine test. The air conduction should be 2 times longer than bone conduction. So we'll test one side here on the mastoid process. Tell me when you don't hear it.
Down here. Down here.
Good. So as I said, that is normal. And then we would test it on the other side to make sure that it is the same bilaterally. So then I'm going to inspect his ear canals and his tympanic membranes. Making sure there's no redness, no drainage. Making sure his tympanic membranes are intact. And making sure that they are within normal limits. So his canals are clear, no redness, no cerumen. His tympanic membranes are easily visible. They're pearly gray, they're intact, no bulging or redness noted, no effusion. I'm going to look on each side. I can see the bony prominences on the good cone light reflex on each side. So his tympanic membrane is normal. So then next we're going to move on to the nose. Looking at it and inspecting it, the skin looks good and even, no rashes or lesions that are abnormal. His nose is nice and midline, there's no pain on palpation, and I don't see any kind of deviation. I'm going to have you look up. And I'm going to look at the septum, make sure there's no deviation in both turbinates, and there's no redness, erythema to the turbinates, and the mucosa is pink and moist, and there are no polyps that are seen. Next, I'm going to have you test the patency of the nares. So include one and breathe in. Good. And include the other and breathe in and out. Okay, good. So everything is nice and patent with that as far as your nose goes. So I'm going to check the lips. Make sure they're nice and pink. There's no cracking. They're moist. I don't see any signs of bleeding or cyanosis. I'll have you open your mouth. I'm going to look in the mucosa on both sides, pink and moist. The tongue is pink and moist. The floor of the mouth is pink and moist. Stick out your tongue. I'm going to look at each lateral side. There's no signs of oral cancer anywhere, no lesions or redness. The teeth I'm going to look at are nice and white. He's not missing any, so he has the right number of teeth. And open. And no cracks or anything in the teeth. He's got good dentition. And I don't smell any kind of foul odors coming from his mouth. Next, I'm going to look at his oral pharynx. I'm going to also look at his hard and soft palate, which will look good. I'm at the anterior, posterior pillars, his tonsils, and then his uvula, which is midline, pink, and moist, and there's no swelling or erythema. There's no exudates to the tonsils. I'm going to have you say ah, which is good. The soft palates and the uvula both rise, and the uvula remains midline, which tests the glossopharyngeal nerve. So then next I'm going to test the gag reflex. So good. That tests the vagus nerve since he has a positive gag reflex. Okay, so moving on to the neck. I look and see, I see that it's midline, the skin looks good, the color is normal, there's no rashes or lesions, I don't see any swelling, so I'm going to palpate, make sure there's no tenderness, right?
Right.
Good, so I don't feel any masses or any kind of nodules on his neck. So then next I'm going to palpate the carotid arteries. So one at a time. Showing rate, intensity, and rhythm, which is all regular at 2+. That's good. And then I'm also going to look at his trachea and make sure it is midline, there's no deviations, and palpate. And that feels good. There's no masses or nodules. I'm also going to palpate the thyroid. So the thyroid feels good. It's not enlarged. I don't feel any nodules or masses, and I'm going to have you swallow. Good. I'm also going to check for any kind of jugular vein distensions. I'm going to inspect to make sure there's no pulsations, which there's not. And also on the other side, there are no pulsations at this time. So we've already assessed trachea, thyroid, so then we're going to listen to the carotid arteries and the pulse and make sure there's no bruise using the bell of my stethoscope. Which that sounds good. And I'm also going to auscultate the trachea. And I don't hear any bruise, so everything is normal. Next, I'm going to assess the range of motion of the cervical neck. So I'm going to have you look over each shoulder. Good, and put your chin to your chest. And then good, look up to the ceiling. So we're going to do the same thing to resistance. I'm going to look one way and the other way. Good, and forward and backwards. Good. So he's got good strength to both active and passive range of motion to his neck. And none of that was painful, correct?
Correct.
So next I'm going to have you shrug your shoulders, which tests the spinal accessory nerve and against resistance. So good, that's both intact and the strength is good and equal. Next, I'm going to inspect the lymph nodes, making sure nothing is enlarged or tender upon palpation. So it's the postauricular, the preauricular, the occipital, the tonsillar, the submandibular, the submental, the superficial anterior, the superficial posterior cervicals, the deep cervical, the supraclavicular, the infraclavicular, and axillary. Which everything feels good. They're all freely movable, and I don't feel any enlargements, and nothing is painful on palpation. So next I'm going to look at his arms. You can see that his skin is even in color, and the temperature is even on each arm. He's got good muscle tone, and there's no pain on palpation. I don't see any lesions. I don't feel any masses. Everything looks normal as far as his skin and palpation goes. I'm going to feel his brachial arteries or pulses, noting intensity, rate, and rhythm, which is all normal at a 2+, and then also his radial pulses, which are equal bilaterally and normal. Looking at his hands, there's no signs of cyanosis. There's no clubbing or pitting to his nails. He's got good capillary refill, less than 1 second, indicating good circulation. And his nails adhere well to his nail beds, nice and strong. Everything looks good there. So then I'm going to test his strength. So squeeze, good. He has good grips. I'm going to have you pull on me, good, and push against me. So he's got good strength in both arms bilaterally. And then I'm just going to have you move your arms around and test. So he's got good range of motion. So then next I'm going to have a look at your posterior back. So everything looks fine on his posterior. I'm going to assess the skin and inspect the back. Everything looks good. I don't see any lesions. I don't see any overt masses or any rashes or anything like that. I'm going to palpate, and there's no pain. There's no crepitus. There's no friction rubs. I don't feel anything. No masses. I'm also going to note that his thoracic configuration, so I can see that it has a normal ratio of 1 to 2 from his AP to lateral diameters. So then next I'm going to assess tactile firmitus, so say 99.
99.
And again.
99.
And again.
99.
So that's good. The vibrations and intensity were felt equally and bilaterally. So then next I'm going to percuss and listening for resonance in a systematic way. Making sure I don't hear any hyperresonance, which would indicate air trapping. And making sure I don't hear any dullness, which would indicate fluid, which I don't hear any of that. It all sounds good. Next I'm going to do thoracic expansion. So I will feel the margins here and then have you take a deep breath in. Now note that my thumbs move in and out bilaterally equally, noting that his expansion is normal, within normal limits. So next I'm going to feel his costovertebral angles, palpate, make sure there's no pain, correct?
Correct.
And then I'm also going to indirectly percuss. No pain?
Nope.
Okay, good. So next I'll assess the diaphragmatic excursion. So I'll have you take a big deep breath in. And I'm going to percuss, listening from resonance to dullness. Good? Go ahead and breathe. And then when you're ready, I'm going to have you breathe in and then exhale and hold it. And I'm going to listen until I hear resonance. Good, breathe. So I'm going to mark that spot if the tape will stay on. And I'm going to measure, and it should be anywhere from 3 to 5 centimeters. So he's right at 5 centimeters, so everything looks fine there. Next, I'm going to listen and auscultate. Make sure that his breath sounds are clear and listen for any adventitious sounds. And make sure that there are no wheezes, rales, or rhonchi. Using the diaphragm, and breathe. So everything sounds clear in all lung fields. Okay, good. So next I'll do the same thing with the both lateral chest bilaterally. First I'm going to inspect. Yep, thank you. His skin looks good on each side. I don't see any rashes or lesions or abnormalities. I'm going to palpate, make sure there's no pain, correct?
Correct.
Good, I don't feel any kind of crepitus or friction rub and no masses or lesions. Next I'm going to percuss and again listen for resonance and make sure everything sounds good. Good. Everything is sounding normal. I'm not hearing any hyperresonance or dullness. Keep your arms up, please, and then next I'm going to auscultate in those breath sounds on both lateral sides and make sure everything sounds good. So breathe. Good. And everything sounds clear in all lung fields. No wheezes, rales, or rhonchi. Okay, so I'll have you turn around and we'll inspect the anterior chest. So you can see that he is breathing rate and respiratory effort is normal. You don't see him labored or in distress in any way, and no use of any accessory muscles. Noting the skin, all looks good and even in color and skin tone, and no lesions noted or rashes. Next I'm going to palpate, make sure nothing is painful, and I don't feel any crepitus or subacute air anywhere. Everything is fine. So after palpating, then we're going to also test his tactile firmitus. So again, say 99.
99.
And again.
99.
And again.
99.
So good. The vibrations feel equal bilaterally in intensity and on both sides. So then next I'm going to percuss and again listen for resonance and make sure everything sounds good. Which it does. I do not hear any hyperresonance or again dullness. So then I'm going to listen to his breath sounds again on his anterior chest and make sure everything sounds good and normal. Again, using the diaphragm. Everything sounds clear. I don't hear any rhonchis or wheezes or rails. Okay. So then we're going to assess, do a cardiac assessment on him, make sure everything is normal. So again, I'll assess the chest here, make sure there's no heaves or pulsations, which I don't see anything. I'm also going to palpate the precordium, make sure I don't feel any kind of pulsations, heaves, or thrills, which I do not feel anything. I'm also going to palpate the apical pulse, which is midclavicular line in the fifth intercostal space, noting rate, rhythm, and intensity. Everything feels normal there. Next I'm going to listen to his heart sounds using both the bell and the diaphragm of my stethoscope. So I will listen to the aortic, the pulmonic, the Erb's point, tricuspid valve, and mitral. And again with the bell, the aortic, pulmonic, the Erb's point, the tricuspid, and the mitral. And everything sounds normal. He has a regular rate and rhythm. No S3, no murmurs, no gallops, and no rubs. So next I will have you get on the bed here and we're going to inspect your abdomen. So looking at the abdomen, I see that it is flat, non-distended. I don't see any pulsations and I don't see any kind of peristaltic movements indicating an obstruction. Next I'm going to auscultate his bowel sounds in all four quadrants using the bells. The skin on his abdomen is good and even color. I see no lesions or rashes. I am hearing active bowel sounds in all four quadrants. Can listen up to 2 minutes if needed. I'm going to also use the bell of my stethoscope and I'm going to listen to the aorta, the abdominal aorta. I'm going to listen to the renal arteries, right and left. I'm going to listen to the iliac arteries, right and left, and the femoral arteries. I'm listening for any kind of turbulence, seeing if there's any kind of bruits or stenosis, which I do not hear anything, and everything seems normal. Next, I'm going to percuss or palpate the abdominal aorta, noting its midline. I don't feel any pulsations indicating an aneurysm. So after that, I'm going to just lightly palpate the abdomen, making sure there's no hernias, no masses, which I don't feel anything. I'm also going to deeply palpate, feeling for the same thing, masses and hernias that I can't feel on light palpation, which I do not feel anything. Abdomen is soft with no issues. Next, I'm going to percuss all four quadrants, listening for tympany and dullness. Tympany is going to be over air-filled organs, and then dullness over solid organs. So then next I'm going to do the liver, percussing from tympany to dullness, which is right about there, and then percussing from resonance to dullness. The liver span can be anywhere from 6 to 12 centimeters. So I'm going to measure him. And he's about measuring at 6 centimeters, so he's within normal and there's no enlargements. Next I'm going to palpate the liver. So I'm going to feel the costal margin, and I have you take a deep breath. Good, the liver is nice and smooth and no nodules there. I'm going to try and feel the spleen. Look again for the costal margin, which I don't feel anything, which the spleen should not be palpable. I'm also going to percuss. I'm going to have you lay on your right side for the spleen. And notice if there's any splenic dullness, so it's mid-axillary line on the post-lateral side. I do not hear any dullness. So everything is splenic dullness, so everything is normal there. Again, palpating the spleen. Don't feel anything. And then also the kidney. And again, the other side on the kidney. Everything feels normal, no nodules or anything like that. Okay, last I'm going to have you raise your head and assess the abdominal muscles that are strong, firm, and smooth. And I don't feel anything there. Everything is fine. And go ahead and sit back up. Okay, so next I'm going to look at the legs. I'm going to see that his muscle tone is nice and even. His skin is even in color. I don't see any lesions or rashes on his legs, and he's got normal hair distribution on his legs. So on palpation, there's no masses. He's got good muscle tone. Everything looks good there. I'm going to palpate his popliteal pulses, his pedal pulses bilaterally, and his posterior tibialis pulses. Noting rate, rhythm, and intensity on all three of those sites. Everything looks good there. Has a 2+ pulses. Next, I'm going to assess his reflexes, and I'm going to first assess the brachial. So relax your arm. Good. Brachial reflex. Good, which is 2+. And then I'm going to do the patellar. Good. And then also the Achilles. Good. His reflexes are normal and equal bilateral, a 2+. Next I'm going to assess his strength. Push out and in. Good. And push down and raise your feet up. Good. So his muscle strength is equal bilaterally. One last thing, I'm going to assess the sensation. So I'm going to have you close your eyes. Is this soft or sharp?
Soft.
Good. Soft or sharp?
Soft.
This soft?
Soft.
And is this sharp?
Sharp.
Good. Oh, I guess I'm telling you. So, sorry. Close your eyes and tell me whether or not it's soft or sharp.
Sharp. Soft. Sharp. Soft. Soft. Sharp.
Good. So his sensation is intact on all of his extremities. I don't see any kind of swelling or edema anywhere, so everything looks fine as far as the circulation goes and his legs. So next we're going to check his back. So I'll have you stand up. So we've already inspected his cervical spine and assessed that. I'm going to palpate his thoracic and his lumbar. There's no pain, correct?
Correct.
Good, so I don't feel any curvature. The spine is nice and straight, so I'm going to have you bend over and assess the range of motion. Good, and come back up. And lean backwards. Good, and come back up. And then lean one side, and then lean to the other. Good, and kind of twist your trunk to make sure everything is good there. So he's got good range of motion of his back, and there's no pain and then no signs of scoliosis or kyphosis. So that concludes our head-to-toe assessment. Thank you, Jeff, for participating, and then thank you for watching. That's it.